Hello friends, let's today talk about slip disc problem or disc herniation problem at L4-L5 level. So let's first understand where is this L4-L5 level. Normally the lower part of our spine is known as the lumbar spine. And in that lumbar spine, the second last disc is known as L4-L5 disc. So basically it is between the L4 vertebra and the L5 vertebra. So the disc or the spacer or the cushion between L4-L5 area is known as L4-L5 disc. Now this disc can be compared to a tire in a car. It has one outer covering which is known as annulus fibrosus and one inner nucleus which is known as the nucleus pulposus. So this disc is a jelly-like thing which is contained in a tire. So whenever there is a disc problem at L4-L5, then this disc comes out of its natural area and start pressing the nerve. Now reasons for L4-L5 disc problem are many, like if somebody is overweight, or if somebody is not exercising, or if the posture is not good while sitting and working, or sometimes it is just age-related degeneration also. Whatever be the reason, if there is a disc prolapse at L4-L5, then there are two types of symptoms. First is, if it is a simple disc prolapse and it is not pressing the nerve, then the patient will have only back pain. Second is, when the disc has come out of its natural position and now it is pressing the nerve also, then there might be a pain radiating down the leg which is known as sciatica. It is like a sharp shooting pain, traveling down the leg like a current. Secondly, it can also cause symptoms of numbness or tingling in the foot. So when there is a numbness or tingling in the foot, that also shows that there is nerve compression. Sometimes there could be frank weakness in the leg, paralysis. So when such things happen, that means nerve is severely pressed and severely getting injured. Or last but not the least, sometimes there is a complication where the patient is not able to pass urine or motion. In such situation, that means that nerve is very grossly compressed and there is a damage to the nerve. So normally in such situation, when you will go to your doctor, he will first do a clinical examination. And after your clinical examination, he will ask you to get one MRI done. MRI will clearly tell us if it is a L4-L5 disc. It will also tell us what kind and what extent of compression is there on the nerves. Good thing here is not everybody requires a surgery for L4-L5 disc prolapse. 97% of the patients, they can be treated without surgery. Normally we put the patient on rest, we start medicines, we start exercises, we start physiotherapy, and we observe for the patient for few days, and the slowly patient can get back to his normal life. In physiotherapy, we concentrate more on core and back muscle strengthening exercises. In medicines, we give medicines for pain, we give medicines to reduce the inflammation. We also give medicines for nerves. And once the patient is okay, we ask the patient to reduce weight, maintain a good posture while working, and be regular in back exercises. Now let's talk about the remaining 3% of the patients where surgery is required. Normally surgery is required for 3 reasons. First is, if the pain in the leg is not settling down in spite of medicines, exercises and physiotherapy. Second is, if there is some paralysis in the foot, that some muscle is not working, the power in the leg has gone down. That is the second indication. Third is, if the patient is having problem in passing motion or urine. This is known as Cauda Equina Syndrome. So normally whenever we take the patient for surgery, it is a small incision surgery or minimally invasive surgery these days. We either do it by microscopic technique or endoscopic technique. Normally the advantage of microscopic technique or endoscopic technique is the incision is very small, almost the size of fingertip. And in that, blood loss is minimum, incision is minimum, we do not cut any muscle, we do not cut any bone. We simply remove the disc fragment that is causing pressure on the nerve. The advantage of this minimally invasive surgery is that the patient can be discharged after 6 hours of surgery. After 6 hours of surgery, patient can stand, walk, climb stairs. And normally at our center, we ask the patient to even go back home. So if you are suffering from L4-L5 disc problem, don't worry. See your doctor and he will guide you correctly, and hopefully you will be fine without surgery. All the best.